Okay, well, good afternoon, everybody. Really happy to have you here. My name is Allison Foster. I'm the Executive Secretary of Delta Omega, which is the 100-year-old Public Health Honorary Society. We've got chapters at CFA accredited schools, about 130 chapters around the world, and we're just delighted to have you here today. So we decided to launch this webinar series focused on professional development. And I'm really happy that we're starting with a terrific session today that's sponsored by the Gamma Pi chapter on careers in different public health sectors. So before we get started, just a couple housekeeping notes. We've got a lot to get through today, but we are going to save questions for Q&A, save a little time there. So if you do have questions, just type them in the Q&A and we will get to them towards the end. Please keep your mics on mute so we don't have any distractions during today's presentations. And just one thing I want to share is that today is not a session to help you find a job specifically. What we're going to do is we're going to talk to you about different careers and maybe pique your interest in avenues you hadn't thought of previously. So without any further ado, I'm going to turn it over to my colleagues from the Gamma Pi chapter. So thank you, Jana Pushkin, for introducing everybody.
And actually, I will start first. I'm Professor Paige Hornsby at the University of Virginia, and I am the faculty liaison for the Gamma Pi chapter of Delta Omega here at UVA that we've had since 2013. And I just wanted to say that we're very thrilled to be presenting this first webinar in the professional development series of 2025. We have lined up a panel of some of our stellar MPH alumni in different sectors of the public health workforce to talk about their career paths and to give tips on working in these different sectors. I will now turn this over to Jana Pushkin, who is Gamma Pi's president-elect, to introduce our panelists.
Good afternoon, everyone. Like Dr. Hornsby said, my name is Jana Pushkin. I'm the president-elect for UVA's chapter of Delta Omega, and I'm excited today to be introducing our four wonderful panelists. So first, representing the government sector, we have Michael Capps, a senior policy analyst for the Virginia Department of Health. We also have two representatives from the nonprofit sector. Olivia DuPont is a program officer for Physicians for Human Rights, and Jess Duska is a climate compliance associate for Self-Help Climate Capital. And finally, representing the for-profit sector, we have Kamya Sanjay, an associate director at Quantified Ventures. So thank you all for being here, and I will turn it over to Michael.
All right. Thank you so much. As you mentioned, my name is Michael Capps. I'm a senior policy analyst at the Virginia Department of Health. So the few things that I'll be going over today, my career path, how I got to where I am now, some of the skills and the knowledge that I use the most in my role and I have throughout my career, a little bit of advice for finding a job in the government public health sector, and then maybe a little word of encouragement or two. First, I was finishing my Master's of Public Health program at UVA in the fall of 2018, and I was commuting from Richmond, Virginia, where I am from. And the Department of Health, one of our alum from the program, reached out to our program director, said that they had an internship slot opening up, and so they recommended me to come down to Richmond into this internship, which ended up working out in our Office of Licensure and Certification, which oversees health facility regulation in Virginia. So I got an unpaid internship. Thankfully for me, it ended up turning into a paid internship before too long. So I was finished out my MPH program there at that internship. And then they moved a little bit of money around, and I got a wage part-time policy analyst position in that same office at VDH. I was working full-time, even though it was called a part-time job. But so I was doing that, a policy analyst role for about a year. And then the money that got moved around ended up running out, as it sometimes does in the government. And I needed to find a different role within the agency. And so in the beginning of 2020, I took a role as a senior management analyst within our Office of Procurement and General Services, and spent about 2 years in that office working in sort of process improvement, business process, administrative functions for the agency. And then towards the end of 2021 in December, I accepted a position as the legislative and regulatory coordinator for our agency in the commissioner's office here at VDH. And so I did that for about 6 months. I'm part of a little team of 3 policy staff underneath our deputy commissioner for governmental and regulatory affairs. And so an opportunity popped up within my team. And so I kind of just moved up within where I already was into what I'm doing now, which is a senior policy analyst in the commissioner's office. So that's kind of how I got to where I am now. When I was in grad school, I was a policy, law, and ethics, found concentration in the MPH program, but also took a lot of management classes. Thought maybe I wanted to do that kind of community health program management route. Didn't end up going that way, but I still use a lot of those skills. The knowledge and skills I use the most. So as a policy analyst, you probably can imagine, I do a lot of policy analysis. So really being able to look at a particular policy proposal. A lot of what we do here in the government is kind of reactive. So either we're reacting to a situation that's going on around us, like COVID, other communicable diseases, things like that. Or like during our General Assembly, our legislative sessions every year, they are just introducing bills that have to do with public health policy. And then so they come to our agency and we analyze them. So we're doing a lot of reactive things, but those skills, being able to look at a piece of policy, figure out exactly what it is intended to do, understanding and mitigating the intended and unintended consequences of particular policy proposals, but also really understanding the mechanisms for how policy moves at the local, state, and federal levels. I certainly focus most of my time at the state level, but understanding how federal policy moves certainly right now, and then also at the local level it helps me to be able to stay in touch and understand how state level policy is interacting with all of the other different levels. Other than that, I do a lot of strategic planning and evaluation. Those skills come in handy a lot. Being able to either making a policy proposal or helping put a plan together for a new program or new initiative, being able to set up a good program that can reach its intended goals, knowing what questions to ask when you're putting a proposal together, and then knowing how you're going to evaluate it is really, really important. And so bringing in those project management skills along with process improvement, as well as stakeholder engagement, along all of those things I work in, it's really important to us that we're bringing in members of the public and other stakeholders. And communication, of course, both with stakeholders up and down your chain of command, with everybody who's going to be involved in the work that you're doing. It sounds cliche, but communication really is important, and you will understand that once you work with someone who does not have great communication skills, and you're like, oh, okay, that's what they were talking about. So hopefully we won't have to be that coworker for anyone else, but if you are, it's okay. Let's see, gonna try to keep within my time. So advice for how to network, find a career in the government sector. This is probably not gonna be super unique to the government side, but internships and really any opportunity that comes up that gives you the chance to interact with or have any sort of experience in that particular organization is going to be really helpful. So finding those internships, a lot of time it is just cold calling and emailing. going on that organization's website, finding the name of a staff person who works on something that you're interested in, and seeing if you can set up a talk with them just to kind of get this kind of information, figuring out how they got to where they are, what kind of projects they're working on. And you may find an opportunity that, again, is unpaid, which is not ideal, but you also may be able to find other ways to get your foot in the door there. And otherwise, just apply, apply, apply. Put in as many applications as you can into as many places as you can. Particularly on the state government side, those applications, I did not get a lot of interviews that I thought I was going to get when I was looking for jobs, because my resume didn't look exactly like the job posting. I wasn't using the right words. And so the people that are reviewing your job application may not be public health experts, and may not know when you describe an experience that it actually does meet a qualification. So you really have to pay attention that you are using the same words in your resume and in your application that they are using in the job description. And other than that, I think joining your state public health association, so like here in Virginia, the Virginia Public Health Association, I joined after already being employed at VDH, but have made a ton of great contacts and really expanded the network of folks that I just know personally, but also that I work with on a number of the different policy projects under me. And then other than that, I know that there is a lot going on in the field of public health right now, and particularly in the government sector. It feels very uncertain for what public health is going to look like for the next several years. But I want to encourage you guys not to give up on governmental public health. You know, certainly at the state and local level, we're a couple steps removed from a little bit of that uncertainty at the federal level. It is creeping in, but still would encourage you, if that's something you're interested in, don't let right now be the reason that you don't do that. But also, public health is a lot of different things. You'll hear that from the rest of the folks on the call today. We all do different things, and you will definitely not have your dream job as your first job. So be willing to take roles that don't look exactly like what you thought you were going to be doing, and just use them as learning opportunities, really build up the transferable skills that you can take on into the rest of your career. And also the full weight of public health does not sit on any one person or organization's shoulders. So find the place that works best for you and go from there. Thanks.
Great, and I think I'm up next, so I'm gonna jump in. Hi everyone, my name is Olivia Dupont. I'm a program officer at Physicians for Human Rights. I graduated from UVA's MPH program in 2019. And so I'm going to be following the same kind of format as Michael, but I'll be using sort of a human rights global health lens. Just a bit about my position. I'm a program officer. I started as a program manager on sexual violence team. Now I really focus more on capacity development across all of our programs. Physicians for Human Rights is an organization that is very small and niche and focuses on documentation of human rights violations. I work in our Manhattan office, but it's been like a little bit of a windy road to get here. So I studied global security in my undergraduate program, focusing on sexual and gender-based violence, and really became interested in this idea of sexual and gender-based violence as a public health issue, which led me to study public health, which I really, really loved, and actually kind of fell more in love with the infectious disease side of public health. So after graduating from the MPH program, I actually took a job working in tuberculosis. So I was working at the Global Tuberculosis Institute, which is a CDC Center of Excellence in Rutgers, New Jersey Medical School. So I moved up to New Jersey and worked there for a little while. And I really fell in love with this kind of intersection of public health and clinical care because I was focusing really on the capacity development, kind of public health side of tuberculosis. But we also had a clinic at the center where patients came in. So I spent a lot of the time, majority of my time, working really closely with physicians and nurses in TB, and just really kind of loved those interactions and that intersection space. So I was really excited when a position opened at Physicians for Human Rights, which was kind of a unicorn position for me, which was working in the sexual and gender-based violence program, working in an organization, you could tell by the name, that's really focused on leveraging the expertise of clinical professionals, but has this really human rights and public health lens. So I kind of like found my way to PHR by exploring quite a wide range of interests in public health. And I think kind of speaks to Michael's point about like, you may not have your dream job at first, but you can kind of like weave your way there and kind of broaden your horizons as you go. So for some of the things that the knowledge and skills I use at my job, I tried to jot down a couple that I thought would be really cross-cutting for folks across public health. So I think the first one, which is one that I did not think I would use a lot, has been just public speaking. This is something that I have ended up using every single day at my job. And it's actually, I think, been like the most important part, or one of the most important skills for upward mobility. I needed public speaking when I was interviewing for these jobs, when I'm leading my team meetings every day, when I've been working on projects kind of in the background on the research side, and then, supervisors have said, can you please go present this at a conference? So I would say if this is something you don't love doing, I think it's something a lot of us are not super comfortable with. Really start working on it now. It's really best to just force yourself to be in those uncomfortable positions and start doing public speaking and, be the speaker for your group project, or like look to present your research at conferences, do improv classes, whatever you need to do to start working on that. Michael touched on this as well, but monitoring and evaluation is also something that has been just a huge part of my work, and I really wasn't expecting it to be. I took my first monitoring and evaluation class at UVA's MPH program, and I had no idea at the time how attractive that was going to be to future employers, and it's something that I've ended up using in every role I've had. So would definitely recommend, if you've never taken M&E or MEL classes, to either take them through your academic program or through online courses. There's lots of free options, but that's something that's been really valuable, like learning how to monitor, how to evaluate programs, how to use kind of logical frameworks. So that's been a huge part of my work for sure. And then I just wanted to touch on as well something we use every single day has been just resilience and self-care. I think the human rights field, the global health field, the nonprofit sector in general can be really emotionally and physically demanding. And I think I really underestimated when I started out kind of the impact of burnout. I'm really lucky at Physicians for Human Rights. It's a huge focus of the work we do. My team spends most of our day working on issues related to sexual violence and torture. So the work is really heavy. And so I've had to spend a lot of time kind of learning those skills. So I think as a young professional, it's hard to like set boundaries. We want to like get a job. We want to be the best at our job. We want to get that promotion. But I think starting out at the beginning of your career by like building in self-care and resilience techniques is something that will really serve you long term. So, and then some advice for networking. One, I would say just really build strong relationships with the faculty and alumni in your networks. If you have graduated already, try to reconnect and stay in contact with those folks. Faculty especially are in those positions for a reason, and those relationships will really serve you long term. And this touches on what Michael shared as well, especially coming from a small nonprofit that I work at. Definitely encourage like reaching out and cold calling. I think it's been something that has worked really well for a lot of the students who have connected with us. And I would say when you reach out, come with a kind of targeted plan and how you can benefit the organization. We've definitely had students reach out in the past who say, I'm just really interested in your organization. What can I do? And when you're reaching out to someone who's, a little overburdened and stressed and doesn't have a lot of time in the day, that can kind of sound like coming up with a project, but if you reach out to a contact, you've done your research on what kind of projects, what kind of activities that organization's doing, and you can send an email saying, these are my skills and this is what I'm interested in, and this is how I can kind of, what I bring to the table for this project. It's really easy for people to see how they can slot you in and how you can be a part of their team. So I would definitely encourage that. We've had lots of students come on as interns or volunteers and then have become paid consultants or have been offered long-term positions with us by doing that. So it's definitely something I would recommend. And then I think just like a couple parting words, I think Michael really said it well about, you don't have to kind of land your dream job at the beginning, but you can definitely get there, and you may fall in love with parts of public health that you really weren't expecting. Public health is everywhere. It's in everything we do. And there's lots of really cool niche positions out there in places you wouldn't expect. So yeah, keep your sights wide. If you have any gaps or pauses between employment, that's really an opportunity to invest in yourself and build your skills. So like take online classes, do Duolingo, even if you just get like basic language skills in another language, that's a huge asset. Volunteer somewhere where you can continue to network. Yeah, and try not to be discouraged. I think it can feel like public health is taking a big hit right now, but it really means public health is more important than ever, and it's going to be needed in the future more than ever before. So as my boss would say, we're going to continue to conspire for good together. So I'll stop there, but please always feel free to reach out if you have any questions. And I know we have time for Q&A that will end as well.
Hi, y'all. I'm Jess Duska. I use she, her pronouns, and I'm, as Jana said, the Climate Compliance Associate for an organization called Self Help. And I graduated from my MPH program in 2019, actually in Olivia's class. So great to be here with you all. Just a little bit about my career journey, which has a lot of similarities to what folks have shared already. But during my MPH program, I did start looking for jobs early. I think it was a little bit of a correction from being in undergrad and not starting to explore hands-on opportunities soon enough. So got a part-time position working for our local food justice network, and was really excited to have kind of a hands-on application of my MPH program while I was in it. So I would highly recommend if you have the time and the space to do to start your professional life during your master's program to try that. And what was amazing about that organization, other than the fact that I was able to apply my MPH skills in real life while I was going through the program, was also that I was able to start building those connections that Olivia mentioned really early, and was able to continue working for that organization, the Charlottesville Food Justice Network, after I had graduated. So I was with them part-time for a few months after I graduated, and as Michael shared with his experience, the program ran out of money. So a parallel between the government world and the nonprofit world, but a lot of the funding streams are uncertain. So don't let that discourage you from doing the good work, but just know that that's always a real possibility. But the organization ran out of funding for my position, and so I was back on the job market. And I will just be totally honest. I think the time after graduating can be one of the scariest and most overwhelming times in your job search, just because you may not know how to advertise all of the skills that you've learned, and you also might be similar to me in that you don't know exactly what you want to do, and so it's almost hard to sell yourself and speak specifically to what you want to be doing at a specific organization. So yeah, just recommend, as Olivia said, taking the time to figure out what those things are, and yeah, I think it will position you really well to be able to tell people specifically how you can add value to their organization. But spent some time trying to figure things out, and then landed at a for-profit, actually, organization called Arabella Advisors, where I was working in nonprofit operations, so supporting hundreds of nonprofit organizations in their back end operations. And I think the skills that I'll speak to from my MPH were a lot of really, really important soft skills that I use in both my current position and my former position. Project management skills, so learning how to manage your time, learning how to stay organized, learning how to prioritize, was definitely something that I struggled with early on in my MPH, but was something that I was able to speak to so articulately going into my first full-time job that is so invaluable. So for those of you out there who are trying to figure out your organization systems, definitely invest. It's an incredible skill to bring to any position. And while it doesn't necessarily sound like public health work, that job at Arabella was very similar to the MPH program in that there was a lot of diversity in the different types of things I was doing and the different types of organizations I was able to support. So I was supporting nonprofits in advocating for reproductive health rights, environmental causes. So I think one thing that I loved about the MPH program was just the variety of different things that you got to expose yourself to. As Michael and Olivia said, policy analysis, there's some quantitative elements, there's a lot of communication skills you build. And so having that diversity and types of work reflected in my role really intrigued me and I think kept me there for a while. So I was at Arabella for 4 years and then earlier 2024, which I was just going to say was this year, feels like this year, early 2024 decided I was ready for a career shift and had the opportunity to take some time off after leaving Arabella to really dive into what I wanted to do. And actually, at the recommendation of our UVA career counselor, I read a book called What Color is Your Parachute that I was very reluctant to read when I was in grad school, but would highly, highly recommend to anyone that's in that place of being confused about what you want to do. And it really helps you just figure out a lot of different parts of what compels you about work, even things as small as what size team you want to be on or what you want your manager to be like. That will again help you to articulate what you're looking for when you're in interviews or writing cover letters for organizations. And so I took that time to figure out what I wanted to do next and had a much smoother process transitioning into self-help, which is my current organization. It's a network of nonprofits and credit unions. And I'm working specifically on grant compliance for their greenhouse gas reduction fund grant of $2 billion. So a huge program. I'm currently in a setup stage building different systems and working on different projects to make sure we can successfully implement that grant funding and get it out to low-income communities that wouldn't otherwise have access to green technology. So really happy to be here. As I said throughout, I think one of the biggest things, soft skills that I took away from the MPH program was just organization skills, time management skills, excuse me, and prioritization. And I also think being able to apply some of these like public health specific concepts, like what Michael was sharing earlier, you learn about the social determinants of health. Like there's a lot underneath what that concept is that people will really relate to, but they might not know the specific term for it. So just being able to apply all of the things that you learned from your program into your job in an accessible way, I think is will be really helpful to you. And I'll just share a few things about my advice. I think you'll have to stick with it if you want a job, but stick with it. It can be a really, really draining process. I think for me, volume was really hard. I did hear people say a lot like apply to everything you can. And that didn't work for me. It's just really energy draining to me. So finding positions that I felt really good about and taking a lot of time to develop thoughtful materials or connect with people at the organization worked a lot better for me, just to not burn myself out of the job application process. So I think different things work for different people. as I said, What Color is Your Parachute is just one book, but doing some background work before you start applying to jobs to figure out what you want and what your skills are and how those skills apply to the job will serve you so well, both in your application materials and in your interviews. And the last thing, I'm an introverted person. Doing the cold emailing, cold LinkedIn messaging, really challenging, but so worth it. And I think what made it less awkward for me was if you have the time, starting to build those relationships before you need them was really helpful. So Kamya and I actually, your next panelist, had the opportunity to connect when I was trying to figure out what I wanted to do between my old job and my new job. And I think just being able to have a genuine conversation and hear about what she was doing and what she was working on without the pressure of asking her for a job or asking her for a referral will totally change the game. So if you have the time to start early and reaching out to people, looking through people's LinkedIn, figuring out what they did previously, what questions you have, and just using it as an opportunity to get to know if it's something that you're interested in and not just having to ask someone for a job really worked well for me. So highly recommend. And yeah, some words of encouragement in this time. I don't think I have anything that other folks haven't said, but just it's a scary time. It's an uncertain time. I think for me personally, the Greenhouse Gas Reduction Fund is evolving every day. So things change and just, yeah, self-care is so important in this time. Be patient with yourself, and be patient through this process because something will happen. Yeah. And I'll end that. Kamya, over to you.
Yeah, thanks so much, Jess. And I'll say, like, as I think the most recent grad of UVA's MPH program of this group, I'm learning a lot just listening to you all. So appreciate everything that was just shared. My name is Kamya Sanjay, use she, her pronouns. I'm an associate director at Quantified Ventures. I'll speak a little bit more about the role in the current job that I have representing kind of for-profit, but want to tell you a little bit about how I kind of got there, as I think similar to maybe like a good chunk of public health graduates really didn't consider the for-profit space when I was exiting school. Like a lot of what I knew was just academia, nonprofit, and I was a little bit scared and reluctant to kind of move into this space, but now I'm very grateful that I did. In my undergraduate experience, I completed pre-medical studies and then also studied equity, justice, and community and healthcare, a major that kind of combined a lot of sociology, anthropology, American studies, to conceptualize healthcare more holistically and kind of understand the factors beyond clinical factors that really contribute to our health. So from the beginning, I was very passionate about holistic healthcare, and which eventually kind of trended me towards public health in the MPH program. Through undergrad in the MPH, I was always working. I really found those hands-on experiences to take what I was learning in the classroom and translate them in a setting that I felt was so much more impactful and really just helped me understand like the work that I was doing and the things that I was learning more effectively. So my very first job in my first year of undergraduate was as a research assistant at a health policy lab at UVA. So spent a lot of time kind of just undertaking very rudimentary policy analysis at that level and understanding what that work was like. I had several internships across college and through my MPH, including working for Virginia Medicaid, which was my dip into government. That was interesting, taught me a lot about insurance and the ways that we provide public insurance in the US. And then during my MPH, I actually held two jobs. One was as an emergency medicine scribe, so working actually in the emergency room to kind of follow physicians around and be part of that clinical care process. The second job that I had was as a research assistant at a public health think tank up in Boston called Ariadne Labs. I was part of their serious illness care program. They were very focused on kind of program level interventions to improve serious illness communication across health systems, across clinics. So it was at that point that I started to kind of marry my clinical interest with my public health interest and start to fit those things together. But something that I think about a lot is I think that jobs and internship experiences have helped me learn as much about what I don't want to be doing in my career as much as what I want to be doing. So with each experience that I was having, I found something was missing. And the thing that was missing was, you know, we're meeting people in the emergency room. They clearly have a lot of different social needs on top of their clinical needs. And I'm discharging someone back into the community that clearly needs more than just medicine from the hospital or some sort of like treatment, clinical intervention, right? So for me, there was this underlying question of like, once this person gets into the community, who's helping them, like who's meeting those needs? At the community level, when I was working as a research assistant and on more program level kind of interventions, I found, okay, well, these programs and community-based organizations exist across, you know, the United States and deliver so much social care to people, deliver all of these really important services. But their work is so challenging, and where is the money coming from for them to be able to do this? Like a lot of these interventions aren't sustainable. They're grant funded programs that might disappear based on, you know, kind of the atmosphere of a certain administration, for example, or just any factor that would cause them to lose footing. So I was stuck with this question of like, how do we support people on the ground that are delivering really impactful kind of social care to people, given that that's where so much of someone's overall health status comes from. So as I was graduating the MPH program, I was thinking I want to get into something that will help me address that question a little bit more effectively. So I was applying to a bunch of different jobs across a bunch of different sectors and reached out to my supervisor from my very first job, that health policy lab that I had in my first year of my undergraduate. And he recommended this organization, Quantified Ventures, to me, said, oh, they're doing really interesting work addressing some of these questions that you seem to be having. No, it seems like a reach, but maybe you should reach out to them and see what they're about. So lo and behold, I reached out to them, began to have some conversations with folks there, eventually applied for the job at my first role, which was a senior associate, and found my way to a for-profit job that was somehow still very impact focused and looking at answering some of the questions that I wanted to answer through my work and like what I was putting myself out to do. I say that to make a point about kind of just networking more generally. I think that like you're always, even just people that are around you and people in your community just are opportunities when it comes to job search. Like any friend, any past person that you've ever worked with is an opportunity to at least ask questions that might be, you know, sticking in your mind and driving you forward towards a particular career path or a particular interest. I think this applies for every sector, not just for profit, but that was something that I ended up, you know, finding really helpful in my job search. What I do right now, QV, Quantified Ventures, is a social impact advisory firm, and we're a B corporation, which means that the work that we do has to foster social and environmental impact for us to exist kind of as a company. And my work is split into two practices. There's a climate finance practice and then a health and human services practice that I currently operate on in my associate director capacity. And the work that we do is very focused on driving capital towards solutions or ideas or programs that are addressing health-related social needs, caring for people's housing, for food security, you know, for respite or recovery, and social determinants of health. These solutions are frequently pioneered by community-based organizations working on the ground, working grassroots, but are typically not candidates for traditional financing mechanisms in the healthcare world, like Medicare or Medicaid benefits, or, you know, sometimes even grant funding is unsustainable. Trying to really drive capital towards these solutions that we see are producing great health outcomes for some of the most vulnerable people across the country. The skills that I use at my workplace on a regular basis kind of range from soft skills that have been described before to more quantitative skills. On the soft skills side, I would say that public speaking is of utmost importance, especially being able to concisely and formulate an idea in a way that's really engaging to someone. I do a lot of kind of multi-sector work. So sometimes I'll be a liaison between a community organization and a Medicaid plan. And those two groups of people operate in very different worlds and have very different like sets of language that they even use to describe common problems. So being able to learn to appeal to an audience and position yourself really effectively and often creatively, I think is a great skill to foster early on, especially if public speaking is not something that's particularly exciting to you, as I believe it isn't for a lot of people. So that's something. Quantitative skills, I do a lot of cost benefit analysis, cash flow modeling, stuff that is, I personally really hated in grad school that I now find is actually like deeply instrumental to the work that I do on a daily basis. Data visualization has been huge. I know that that's something that's becoming more prominent, but understanding how to impactfully share data to convince people that you're dealing with a really important problem. And then the last thing that I think was unexpected in my current role, but comes up a lot and I think has been an asset in my particular sphere, given that a lot of people might not know this, is health impact assessment. I took a course solely focused on health impact assessment while I was in my MPH at UVA, and found that it allows me to substantiate a lot of my like mission or impact driven claims with evidence and an actual framework for how I'm like identifying target populations of focus for a particular program, and identifying and describing what need looks like and where impact can be driven the most. I think that that's been really, really helpful. Most excitingly, I think to me now, like, and a thread that's connected through my experience, regardless of what sector I've been in, I do a lot of work right now with community health worker programs across the United States. I was passionate about community health workers for a very long time. I wrote my master's thesis on community health workers and my work with them in under-resourced environments in South Africa and in India, and have been able to take my passion for that role and turn it into something that's actually a marketable solution, which has been really interesting and very different from how I expected that trajectory would go. But now I'm able to actually like describe and share the value of this workforce to a lot of different partners across my work. So another just general tip, and I think this applies to both networking and like where you're driving yourself in your job search, is let your passion guide you, even if that's a small idea and not necessarily an expansive vision of where you want your career to go. If there's an idea that's been really intriguing to you in your classes, like don't hesitate to start digging into those ideas and exploring what it might look like for you to engage with them deeply through your career, whether that's talking to people that do this kind of stuff on a regular basis, or you know, joining organizations or associations that hold conferences and promote whatever it is you're interested in. Just dig into the things that make you really excited, because those are the things that usually, at least in my like impact for-profit space, right, really drive a lot of attention, resources, and your ability to make change and exert impact. I guess the final thing that I'll say in light of our existing environment is that, like, I feel like a lot of work has been, I live in Washington, D.C. A lot of the environment around here is crazy. A lot of the work that's been happening feels like climbing up an endless mountain. Like, it just feels like a lot of things are going to be on pause. I see it every day with the clients that I work with. So many community organizations that are just worried about their livelihood and their ability to actually serve the communities that they want to serve. I think that something that's made me feel better is that challenges have always kind of existed administratively, and there's a lot of work out there that's attempting to kind of sidestep these challenges that exist. A lot of the work that I do, I feel that way about, because it's not operating within kind of traditional structures of governance. So trying to put yourself in places where you can see around some of those challenges that will always exist and begin to think creatively and dream big and think expansively, I think is like really powerful right now, rather than something that should be discouraged, particularly because, as I think Olivia mentioned before, like public health is here to stay. If it feels hard right now, it's because we need it more than ever. And we need people who are thinking about improving the lives of communities in whatever capacity they're able to do. Like, we need people doing this on a daily basis. So not the most, I think, optimistic angle, but like something to think about. And yeah, I think that that's all that I have. So Dr. Hornsby, maybe I'll push it back to you to help us facilitate some Q&A.
Thank you all so much. Really, really informative. Really appreciate you taking time to share your growing expertise with us. I'm actually going to hand it over to Allison. She will handle the Q&A and more.
Yeah, absolutely. All right. Well, that was terrific. I know it's given all of you a lot to think about, but go ahead and put your questions for these esteemed panelists into the Q&A. So I know they have more advice to share. So I can see one question Somebody's asking about the advantages of going on to earn with terminal degrees like a PhD. How would, in your estimation, how would that have helped you in your career path? And any of you can answer.
I'll say so. A PhD typically is a fairly academic degree. So if you're interested in the academic side, then I think a PhD could be useful. I definitely do work with some PhDs in the Department of Health and some of our partner organizations. To be honest, at least within like the work that I do, having a PhD or not may not. It's hard to tell that I can't definitively say yes. It's going to be, get you $100,000 extra a year or something like that. I will say though that the people I have worked with PhDs, are very, very talented and high level subject matter experts and advance in their career accordingly. But I also know people who are doing that without a PhD. I know there's some growing attention to the DRPH programs, including myself. I'm thinking about that. So that's kind of the applied sort of executive like workforce version of a PhD, not quite as academic. So something else to think about if someone's really interested in a few extra letters after your name.
So we'll go on to the next question, which is, so it's been interesting to hear your different career paths. What do you think the type of employment would be the easiest to find a job in right now? Because I heard from all of you, it doesn't have to be the perfect job. You just need to start working and you will find a way to the job that you love. So from your collective perspectives, is the sector you're working at, is that a good place for folks to get started? Tough question to answer, isn't it?
Very hard. I don't think this response necessarily speaks to the current environment, but I will say, as someone who flipped between the nonprofit and for-profit space before landing where I am now, obviously it depends on the organization, but I found that in the for-profit space, at least in a larger organization of 150 to 500 people, there was a lot more opportunity to get my feet wet in different types of work. Whereas the nonprofit that I started in and the nonprofit I'm in now were much more directed positions. So if you are someone who's contemplating a variety of different roles and don't really know what you want to be doing yet, I think looking for that in a specific position is important. And I found there was a lot more of that in larger organizations and in the for-profit space where maybe the financial resources are a little bit more available to employees and professional growth. But if you're someone that knows what you want and are very passionate about it, I think the nonprofit space has shown to be very receptive to that mission orientation.
I would say for the human rights space, it's I think it's really hard to get your feet in the door because it is quite niche, but I would say that there's been in my organization and kind of like our sister organizations, there's a lot of jumping back and forth between different organizations once you get your feet wet, kind of like Jess said. And I think if you're looking to go nonprofit, and I guess actually in any field, I would also recommend like getting yourself familiar with the different role titles and what they mean, because I think they can be pretty confusing, like associate, program officer, program coordinator, program manager, and kind of getting an idea of what those different roles entail. And I think if you're willing to kind of start in a coordinator and associate role, it's an opportunity to feel out a lot of different areas within an organization. I think it's kind of like always an all hands on deck situation at most nonprofits nowadays. And so if you're able to get one of those like entry level positions and then really kind of feel out how the organization is run and which roles really speak to you, it's much easier than push your way up. So I don't know if that answers the question, but just some food for thought.
Okay, I'm going to move on because we have a bunch of great questions. I love this next one. Have any of you all ever experienced imposter syndrome? And if so, how did you overcome it?
1,000,000%. Yeah, 1,000,000%. I'll say, like, I think my most recent experience was in the context of moving into my current role. I applied for a position that I was fundamentally slightly underqualified for, with the tag of like, oh, women don't typically apply for positions that they're underqualified for. Like there's a study out there, I'm sure, that y'all have kind of heard about. Threw myself into it based on, I think, like a desire to do that kind of work and passion, like something I keep bringing up. And once I got into the role, I was like, okay, well, now there are a lot of skills that I feel like I might be slightly behind the curve on. I think approaching any role as a process of constant learning and betterment is the way that I have previously addressed my imposter syndrome. If there's some of those feelings, I think, come from being a little hard on yourself and feeling challenged by the work that you're doing. But I think the challenge is always something that you can rise to if you feel like there's a skill set that you want, that would make you, feel more confident in your role that you don't already have, seeking out opportunities to do so. For me, the biggest example of that was financial analysis. I came into my job like not liking it very much, having to do a lot of it and feeling like I lacked the tools to be able to perform successfully, but threw myself kind of into learning more and then develop my confidence both in the skill set and my like enjoyment of the actual process, which I think really helped me to feel more secure in that. So I think that approaching everything is like, oh, this is a place where I can continuously learn. I'm not going to hold myself to an impossibly high standard just because I feel like I have to be meeting this right off the bat. It's always okay for me to be adding new tools to my skill set.
Allison, before we move on, I would also love to say I 1,000% also have had imposter syndrome in every position that I've had. And if you have the opportunity to talk to other people, I think you'll find that other people, if you're feeling it, are also feeling it. And so wherever you can, building community in your organizations and sharing resources, sharing skills. I think being in the workforce teaches a lot about the opposite of competition and creating shared resources between you and other people that are in your position. That's really amazing and will help you both grow in the way Kamya was just mentioning.
Okay, so next question is, how do you know when it's time to move on to a new position or seek a promotion? Sounds like some of you have been there. So what was it that told you it was time?
So, I mentioned, I think maybe it was Jess in the nonprofit space, sometimes your circumstances will tell you that for you. You're in an organization that runs out of money for your position, and they tell you it's time. I think in a situation where that's not the case, so my second, I guess technically third position at VDH as a management analyst, I really only took that job because my first like real job at VDH lost funding. I was like, I'll stay here for 3 to 6 months and just jump on the first policy position that comes up within the agency because that's what I want to do. Again, circumstances had different plans for me. I started that role at the beginning of 2020. Something big in public health also happened right around then. So we had a hiring freeze and I was stuck in that position for 2 years. But I could, had I had the option, I probably would have left that role about the 1 year mark. Because for me, I could tell I wasn't really challenged anymore. It was everything I was going to be able to learn from that position, I had already learned. And I didn't feel like I was, I wasn't passionate about like waking up and going to work and doing that job every day. And I'm certainly not every single day now, but I know that I'm coming here and I'm doing something that that I am good at, but is a challenge. And I'm constantly learning new things, seeing new situations, getting opportunities to work on different projects at different levels. And so I think if you realize that I don't think I have to really that much more to give here, and I don't think that I really have much more to get here, and I need to change my circumstances to get that. And you probably know when you're feeling that. So if you start to feel that, I would say talk to the trusted people around you, and also look at what other opportunities are out there that might serve you better.
All right, I was going to say we just do one more before the hour is up. So thinking a couple of these, I think that you talked about, they were typed in before. So here's a question: there's a question is, what challenges does your organization is it currently facing, and how do you think your organization's in a position for navigating around those? So maybe we could just do a real quick round, like 30 seconds, all four of you could just give your perspective on that from the perspective of your position.
To kind of kick things off. As I mentioned before, a lot of the work that I do is with community-based organizations trying to seek financial sustainability. A lot of them are grant funded, a lot of them are federally grant funded, and are seeing a lot of what they do fall under them. I was on the phone with a hospital system a couple of days ago that explained they had to cut off several of their hotlines as they will no longer be receiving federal support. Like a lot of scary things, I think, happening for the people that are tackling issues of social care kind of on the ground. What makes me feel hopeful about how we can respond to it is that when you already work in an innovation space and you're already trying to work around, like I mentioned, existing guardrails, you're always thinking about what we can do kind of in excess of structures that exist around us, not just within the confines of, certain government processes. So I think that that's been something that's been helpful. And I think that it's brought to light broader questions for all of us to consider about financial sustainability in the public health world. I think that if you've ever worked at a nonprofit or any place where your funding is contingent on, asking, for example, donors or philanthropists to buy into your mission, or contingent on government aid, it becomes really challenging to perpetuate the organization through all of that. So I think that bringing those questions to the forefront is also just really important for us, kind of as a community or as an industry, to be considering moving out of this. That was less hopeful than I expected, but.
Why we're here, to find the hope, right? So anybody else want to try to answer that one?
Yeah, sure, I'll jump in. Yeah, similarly, funding is a huge issue right now, of course, under the current administration. It's we're kind of feeling it personally at our organization, and all of our partners are also feeling it. We're kind of watching some organizations around us like completely deplete. So one thing we've been doing a lot is kind of tapping into existing networks to find ways around projects that have funding pauses. And I think this is really where that like public health kind of community networking space comes in as well, where you know, we have a training that we need to do for a group that's really urgent, and we just lost all the funding for the trainers. And you know what, I know this person who works at the World Bank and who will do this training because, you know, they have this public health background and it's an important mission to them. And like trying to find creative ways to kind of move around some of these funding issues through those public health connections. And we also have been experiencing really huge challenges around security. We work almost exclusively in conflict zones, which there's a lot of kind of brewing and growing conflicts in the areas that we work. And so just being like really adaptable in our approaches. And, you know, when things were supposed to be in person, maybe they're going to be virtual. You know, we were supposed to go to this country, we're going to go here instead. So I think being like really reactive and quick on your feet has been something that we've had to do for all our areas of work.
Okay. All right. This has been fantastic. We're going to have to close it out now. But I want to give a huge shout out to Gamma Pi chapter for pulling this together. Wonderful panelists. You all did a great job explaining different perspectives at this really important time. And I do hope those of you participating will join us for our next one on April 1st. We're going to be looking at professional development tools for early career professionals. All right. So thank you, everybody. Have a good afternoon. Bye-bye.